I would love to take a few minutes and discuss gum disease with you. So many times in dentistry and, well, in medicine and life, we just deal with the symptoms. We don't ever deal with the cause of the problem. I would really like to show you what the cause of the problem is so that we can really properly deal with gum disease. Okay. A tooth. Okay. A tooth is held in the mouth with bone. You know this. Over the bone there's gums. Okay? Now everybody has bacteria in their mouth. Now bacteria plus sugar makes acid. You know this too. You have a bunch of Cokes, you have a bunch of candy, you have a bunch of breath mints, that kind of stuff. The bacteria get a hold of it, make acid. Same thing if you put gasoline in your car, the byproduct is exhaust. You put sugar in your mouth, the byproduct is acid. Bacteria and the sugar usually forms cavities in the teeth. The dentist goes in here, drills this, fills it, all that kind of stuff. You already know all this. Now, somewhere along the age of 23, 24 years old, the bacteria become less interested in forming cavities, more interested in forming gum disease. So what is gum disease? Bacteria is plaque. Bacteria is tartar. All the same thing. Bacteria, plaque, tartar, all the same thing. Except for the tartar is hard. Easy enough. When you get a little bacteria, plaque, tartar on the tooth, the gums don't like it. The gums swell up. The gums get a little puffy. The gums begin to bleed. Okay? Now when you go to the dentist and they check your gum pockets, have you ever heard of them? The gum pockets is what the dentist measures. Okay? What they do is they measure from the top of the gum to the bone level. They measure this right here. Now, 1 to 3 millimeters is good. That's healthy. That's great. 4 to 6 is not good. Okay? 7 plus is bad. Let me tell you why we distinguish between them. Once the gums get swollen, once they get puffy, once they start bleeding, it creates an environment in this area, a toxic environment for the bone and the gums, really, but it's inflammation. What happens is then is the bone goes away. Okay, so what is gum disease? Bacteria on the teeth that causes the bone to go away. So many people think, well, the purpose of flossing is to remove the chicken or remove the food between the teeth. That's not the point. The point is to remove the bacteria, to remove the plaque from the teeth. Okay? One thing I want to describe here is between 4 to 6 millimeters, that's usually a manageable, you and the dentist can manage the gum disease. Okay? Gum disease usually can't be cured, it's managed. So if you're in the 4 to 6 range, that's manageable. Usually you can have frequent cleanings and things like that. Your hygienist can do extra things to keep it under control. But once you get into the 7 plus range, once you cross the line to the 7 plus range, then we start thinking, well, are we going to lose the tooth? We have to do gum surgery, things like that. The key here is the cause of the problem. Bacteria is the cause of the problem. You manage that, you can manage all these different things. That is what gum disease is.